Theme of today's lecture is the axillary artery. First of all, we should like to discuss the division of axillary artery into segments. There are three segments of axillary artery, and using this picture from textbook of Sapin, here the designation in Russian, but nevertheless in Latin, we can find the name of each segment. So there are three segments. Number one, which is projection of branches to the so-named trigonum clavi pectorale, trigonum which take place between clavicle and upper edge of musculus pectoralis minor. Segment number two is trigonum pectorale, which corresponds to projection of musculus pectoralis minor to the surface of the thorax. And segments number three is trigonum subpectorale, trigonum which is located from lower edge of musculus pectoralis till lower edge of musculus pectoralis minor till lower edge of musculus pectoralis major. So this is trigonum subpectorale. These three segments we shall use for understanding of each branch and to distinguish them in the specimens. And now let's try to find all the branches in this scheme. First of all, let's ask ourselves, where is the border between arteria subclavia and arteria axillaris? Surely that arteria axillaris is prolongation of arteria subclavia, and this dotted blue line demonstrates the border. We can say that border between arteria subclavia and arteria axillaris take place on the outer edge of first rib. So laterally of outer edge of first rib, we can find arteria axillaris. And now we shall demonstrate this first segment, trigonum clavi pectorale. In this trigonum clavi pectorale, we can find vessel number one. It's arteria thoracica superior, which branching on the first and second inter-rib spaces and supplies with blood the soft tissues of this region. And parallel to it, we can find arteria number two, truncus thoraco-acromialis, truncus thoraco-acromialis, which later shall divide into several branches in region of clavicle and lateral wall of the thorax. So these two vessels, they are vessels of first segment, which we designate with blue color. Now the segment, the second segment, trigonum pectorale, we shall use this yellow color to demonstrate it, and here we can find only one vessel, number 3, arteria thoracica lateralis. Arteria thoracica lateralis, number 3. When we designate that this vessel have place in second segment, it means it starts in second segment, but then it will pass quite long distance on the lateral surface of the thorax. And then number 3, segment number 3 is trigonum subpectorale. Trigonum subpectorale we shall colorize with green color, and we shall find here 3 arteries. First of all, arteria subscapularis number 4. It divides into arteria thoracodarsalis number 4A and arteria circumflexa scapulae, which we designate as 4B. Then we shall find arteria circumflexa humeri anterior number 5 and circumflexa humeri posterior number 6. Pay attention, please, that arteria circumflexa humeri posterior is more large diameter than arteria circumflexa humeri anterior. It's more thin. So arteria circumflexa humeri posterior should be more easily demonstrated in specimen. So also we use the same color, green color, to colorize our scheme. So 3 segments and 6 vessels. This is main branches of arteria axillaris. Now some very important topographically oriented questions, foramen trilaterum and foramen quadrilaterum. I'd like to remember you these spaces which connects posterior surface of the arm and superior girdle of the extremitas superior and anterior surface of the arm and cingulum membri superioris. So here they are, foramen quadrilaterum and foramen trilaterum. And now more detailing. Just now we use the front view of foramen trilaterum. We use this black arrow to demonstrate it. And let's remember the walls. First of all, number 1 is superior wall, musculus subscapularis. It's all musculus subscapularis. And number 2, inferior wall or musculus teres major. Foramen trilaterum, it means we shall find third wall. Third wall is lateral wall. It's caput longum musculus tricipitis brachii. And what is content of this foramen? Content of this foramen is arteria circumflexa scapulae, and together with it we can find the veins with the same name. So arteria et vena circumflexa scapulae. And now the same foramen trilaterum from back view. Let's try to distinguish all the details. Here it is foramen trilaterum, and from back view number 1 is superior wall. It's musculus teres minor. So we can understand that superior wall from the back view and from the front view, they are different. From back view, it's musculus teres minor. But two another walls are the same. Inferior wall is musculus teres major, and number 3, lateral wall, is caput longum musculus tricipitis brachii. The content of this foramen is the same. If we watch from back or from front, we can find only arteria and venae circumflexa scapulae. And now foramen quadrilaterum. First of all, we begin from back view. Here it is foramen itself, and what are the walls? Some of walls corresponds to the same walls of foramen trilaterum. For example, superior wall is musculus teres minor, inferior wall is musculus teres major. They are the same like foramen trilaterum. Medial wall is caput longum musculus tricipitis brachii, and lateral wall is new wall. It's column humeri. We can find in this picture that musculus deltoidus was cutted especially to demonstrate this part of humeral bone, which is chirurgical column, chirurgical neck. So we can say that column humeri is the lateral wall. What is the content of foramen quadrilaterum? First of all, arteria et vena circumflexa humeri posterioris, and also nervus axillaris. Now, it's good possibility to say that usually arteries do not goes as single structures. The common rule, common anatomical law declare that usually arteries go with adjacent veins and nerve. So they form neurovascular bundle. And here we can find that in neurovascular bundle in foramen quadrilaterum is nervus axillaris. So nervus axillaris accompanies arteria and vena circumflexa humeri posterior, which goes inside this foramen. And together we can demonstrate them in our previous scheme, foramen trilaterum, foramen quadrilaterum, and the summary. That foramen trilaterum has walls musculus teres minor, teres major, caput longum musculus tricipitis brachii, and the content is arteria circumflexa scapulae. And foramen quadrilaterum has as a walls musculus teres minor, teres major, caput longum musculus tricipitis brachii, collum chirurgicum humeri, and the content are arteria circumflexa humeri posterior plus nervus axillaris. So it's information for remembering this question. And now, good picture which can help us to understand that all arteries communicates with each other, making anastomosis. This is number 1 is arteria axillaris, and this is number 2 is arteria suprascapularis, which is branch of arteria subclavia, exactly truncus tira cervicalis from arteria subclavia. And here with red circle we can demonstrate foramen suprascapulare, the space between incisura suprascapularis, here it is in the scapula, at ligamentum transversum scapulae superior, here it is. And number 3, arteria dorsalis scapulae, branch of arteria transversa colli from subclavian artery. And number 4, musculus levator scapulae. Number 5, musculus rhomboidus, here it is, number 5. And number 6, here it is, number 6, arteria subscapularis. From arteria subscapularis through this trigonum quadrilaterum passes number 7, arteria circumflexa scapulae. Through this foramen, this arteria reaches of dorsal surface of the scapula and communicates with ending branch of arteria suprascapularis, number 2, and also communicates with number 3, arteria dorsalis scapulae. So it's good possibility to understand that scapula is supplied with arteria quite good because there are a lot of muscles here. Number 8, musculus teres major. So this is good scheme, and I'd like to remember you that before your oral exam, it will be obligatory for you to have a special electronic test, and this test will use this scheme for distinguishing what is number 1, what is number 3, what is number 6, and so on, as an anatomical task for you. So, arteria axillaris is finishing, and now the next prolongation of arteria axillaris, which is arteria brachialis. Arteria brachialis, because it prolongates arteria axillaris, should have a border between previous artery. So this border will be lower edge of musculus pectoralis major. We can find here the projection of musculus pectoralis major on the surface of the body, and lower edge of this muscle is the border. So here it is arteria axillaris, and here it is arteria brachialis. Now what are the main vessels of Arteria brachialis? First of all, Arteria Profunda brachii. Here it is. Profunda brachii starts at the place where Canalis spiralis begins. Canalis spiralis is a special canal between humeral bone and musculus triceps brachii. Through this canal, we can find that nervus radialis and arteria profunda brachii, they pass together. So arteria profunda brachii, first branch. Then we can find that arteria profunda brachii divides to arteria collateralis media, here it is, and arteria collateralis radialis, here it is. And second large branch is arteria collateralis ulnaris superior. Here it is, arteria collateralis ulnaris superior and arteria collateralis ulnaris inferior. Pay attention, please, that arteria collateralis ulnaris superior originates quite high in the middle part of the brachium, and arteria collateralis ulnaris inferior isn't long. It originates practically at the condylus humeri. So the space, the distance between of origination of arteria collateralis ulnaris superior and collateralis ulnaris inferior, this distance is at least 10 centimeters, and sometimes more, 15 if a person is quite high. So practically we can say that arteria brachialis has only 3 large branches: profunda brachii, collateralis ulnaris superior, and arteria collateralis ulnaris inferior. And now, very important to repeat that arteria profunda brachii goes in the content of neurovascular bundle, which consists of arteria vena profunda brachii and nervus radialis. This is the place of starting of canalis humera muscularis or canalis spiralis. You know that this canalis humera muscularis or canalis spiralis has also a third name: canalis humera muscularis, canalis spiralis, and also canalis nervi radialis, because radial nerve is a main structure in this canal. And we shall remember the main muscle in this scheme. Number 1, biceps brachii, caput brevis. Number 2, musculus coraca brachialis. Number 3 is caput longum musculus tricepitis brachii. Number 4 is musculus brachialis. Here it is, number 4. And now, very important question: rete articulare cubiti. We can understand that elbow joint is very mobile joint, and that's why in different position of an arm and an forearm, it's necessary to, in each moment, have good blood supply. And that's why very useful for us to know this scheme by heart. And I ask you to study it detailedly. For easing this process, let's draw it together. So, first of all, we shall draw this distal part of humerus, and now the proximal part of os radius and proximal part of os ulna. It would be good to answer the question, is it right hand or left? Sure, right hand, да? Because a person is anteriorly to us, face by face, and we should remember that radial bone is always laterally located in forearm. And very useful information that in different position of the hand, first finger is placed laterally. That means first finger corresponds to the radial bone and fifth finger corresponds to the ulnar bone. And when we know this, let's draw the main vessels. They are Arteria brachialis, which finishes in the projection of collum radii and collum ossis ulnae. So, number 2, arteria ulnaris, and number 3, arteria radialis. It means that arteria brachialis divides into arteria ulnaris and arteria radialis. It's a good possibility to declare an anatomical rule, an anatomical law, that if there is one main bone in the region, for example, os humerus, the main vessel supplying it is also one. Arteria brachialis is one in account. And forearm, which has two bones, radial bone and ulnar bone, they correspond also to two arteries supplying this region. So, two bones and two arteries. One bone, one artery. It's a good rule for understanding that our body is quite logically created. And now let's continue the draw rete articulare cubiti. Rete articulare cubiti consist of 8 vessels, 4 descending arteries from arteria brachialis and 4 ascending arteries from radial and ulnar arteries. So, first vessel is vessel designated as number 4, arteria collateralis ulnaris superior. And parallelly to it, number 5, arteria collateralis ulnaris inferior. How we can distinguish them in specimen. First of all, the main rule that arteria collaterales ulnaris superior goes posteriorly to the medial epicondylus, and arteria collaterales ulnaris inferior goes anteriorly to medial epicondylus. This place where we can find arteria collateralis ulnaris inferior, we can palpate because sulcus arteria ulnaris is quite painful when we palpate, because superficially under the skin with this arteria collateralis ulnaris superior also passes nervus ulnaris. And when we palpate, we feel the pain due to this reason. And now, third vessel, number 6, I designated arteria profunda brachii. It's understandable why we use dotted line, because arteria profunda brachii goes posteriorly to the bone. It means we can't see it through the bone, and we only draw it here, but nevertheless it couldn't be seen from front view. And the ending of it, of arteria profunda brachii, could be seen, it's number 7, it's arteria collateralis radialis. Arteria collateralis radialis. The next very important information, that arteria collateralis radialis goes together simultaneously with nervus radialis. So they are accompany each other. Arteria collateralis ulnaris superior accompanies nervus ulnaris. Arteria collateralis radialis accompanies nervus radialis. And arteria collateralis ulnaris inferior accompanies nervus medianus. And last descending vessel, number 8, again with dotted line. It means it's impossible to demonstrate it in specimen. It goes inside of the muscles, exactly in musculus triceps brachii, and that's why practically it shouldn't be seen on specimen. So we finished 4 descending vessels, and now we shall draw 4 ascending vessels from radial and ulnar arteries. Number 8, arteria recurrens ulnaris. Here it is. Arteria recurrens ulnaris divides into 2 branches. One of them is number 10, arteria recurrens ulnaris ramus posterior, and another is number 11, arteria recurrens ulnaris ramus anterior. So arteria recurrens is single artery, but nevertheless it divides into rami, ramus anterior and ramus posterior, which communicates with collateral arteries. So 2 arteries we already designated, and now number 12. Number 12 is arteria recurrens radialis. Here it is, arteria recurrens radialis. We again should say that arteria recurrens radialis accompanies nervus radialis. They goes together. And last 8 artery in this scheme. For draw it, we should designate number 13 and 14. They are arteria interossa communis and arteria interossa posterior. So you remember that two bones of antebrachium, they are connected with membrana interossa, and anteriorly to it and posteriorly to it goes two interossal arteries, and they are started with single bundle number 13 interossus communis, and then become interossus anterior and posterior. From arteria interossa posterior, we designate vessel number 15, also with dotted line, because it couldn't be seen inside of the deep muscles, arteria interossa recurrens. Arteria interossa recurrens. Arteria interossa recurrens communicates, communicates with arteria collateralis media. So there are 4 descending branches, 4 ascending branches, which communicates, forming anastomosis between them, and from these 8 arteries, we can't find in cadaveric specimen only these 2, collateralis media and recurrens interossa, arteria recurrens interossa. They couldn't be seen. Another 6 artery could be demonstrated in our cadaveric specimen. And now the scheme which looks like a natural specimen, so you can try to compare them and to find all these small branches. The next very important material is material about arteries of the hand. I use this scheme, maybe not in supreme quality, but nevertheless quite understandable. And using this example, I'd like to demonstrate to you scheme which I made previously on the table, and I ask you to make a photo. It would be very important for us. It's scheme not pretend for good artistism, but nevertheless it's quite understandable. First of all, please answer me, is it right hand on or left? Sure, it's a left hand. We see the palm, and it's left hand. First of all, we can understand that there are 2 arcs here, arterial arcs, number 1 and number 2. They are designated as abbreviation not arteria, but arcus palmaris superficialis, and number 2, arcus palmaris profundus. Arcus, it's understandable. It is curved as an arc, and each of them, besides one is superficial and another is profound, they are prolongation of main artery of the forearm. That means that arcus palmaris superficialis is prolongation of AU, arteria ulnaris. This is AU, arteria ulnaris. And another arcus palmaris profundus is prolongation of AR, arteria radialis. And the next question, where they are located. In this scheme, quite understandable that arcus palmaris superficialis is more distally located. It means in the middle of palm, transversely in the middle of palm, and arcus palmaris profundus more proximally located in the projection of ossa carpi, region of carpus. And why they are arcs? Because there is anastomosis here between each arcs and main vessels. So let us try to understand arcus palmaris superficialis, by which vessels it is formed. First of all, by arteria ulnaris, ending part of arteria ulnaris, and RPSFC. Ramos palmaris superficialis. This abbreviation, Ramos palmaris superficialis. Which branch is this vessel? Branch of arteria radialis. So arteria radialis gives this ramus palmaris superficialis for making anastomosis with arteria ulnaris. And analogically, this vessel, ramus palmaris profundus, this abbreviation, ramus palmaris profundus. Ramus palmaris profundus connects arteria radialis, the ending part of arteria radialis, and arteria ulnaris. So this scheme is quite understandable for logically possibility to remembering this material. So arcus palmaris superficialis equal, it's equation. Arcus palmaris superficialis, arteria palmaris superficialis from arteria ulnaris, plus ramus palmaris superficialis from arteria radialis. And Analogically, arcus palmaris profundus equal arteria palmaris profunda, here it is, number 2, from arteria radialis, it's an ending part of arteria radialis, plus ramus palmaris profundus from arteria ulnaris. So, this abbreviation which we designated in this scheme, I explained with this equation for remembering. And this is another example. I also recommend you make a photo for trying then to copy by heart practically the same but more detailedly. We also made this scheme before, and I recommend you try to do it itself. Not itself, but yourselves. Okay. And now I'd like to demonstrate here arcus palmaris superficialis. Here it is. Here it is. Arcus palmaris superficialis. Quite close to the skin of palm. That's why any injury of this region is quite dangerous in according to avoid of serious bleeding, because superficially is quite large vessels. And in this scheme we can find ramus palmaris profundus and arcus palmaris profundus. So here it is, arcus palmaris profundus. Here it is. It is a result of communicating ramus palmaris profundus arteria ulnaris and arteria radialis itself. Now, it would be good to say that arcus palmaris profundus is located at the level of proximal third of metacarpal bones, and it gives 4 palmar metacarpal arteries. So arcus palmaris profundus serves for blood supplies of 4 palmar metacarpal arteries. Arcus palmaris profundus, again equation, equal arteria radialis, distal part of this artery, plus ramus palmaris profundus, arteria ulnaris. For understanding this equation will help us to remember. And now, very important also question, rete carpi palmare. Rete carpi palmare, which is located on the front surface of the wrist joint in the area of ligamentum carpi radiatum. Rete carpi palmare is located on the front surface of the wrist joint in the area of the ligamentum carpi radiatum. Here it is, this scheme. and rete carpi palmare are surrounded by this yellow circle. So inside of this yellow circle we can find rete carpi palmare. We can say that rete carpi palmare, again equation, it's very easy to remember when we use equation. Rete carpi palmare equal ramus carpius palmaris arteria ulnaris. Here it is, arteria ulnaris, and it makes ramus carpius palmaris. Here it is. Plus ramus carpius palmaris from arteria radialis. Here it is. Ramus carpius palmaris arteria radialis. So they are communicating with each other, making anastomosis here. And also we can find arteria interossa anterior. Here it is, arteria interossa anterior. And it also communicates with previous arteries, forming these rete, arteria interossa anterior. So these three vessels communicates and forms rete carpi palmare. First of all, it's necessary to blood supplying of wrist joint. Its first function. But also its contacts with arcus palmaris profundus. So here it is, arcus palmaris profundus, and they are anastomosis with each other. So, rete carpi palmare. But beside of it, there is a rete carpi dorsale. You can recognize that this is dorsal surface of right hand. Do you agree? And rete carpi dorsale we can find here. Do you see that all the ligaments and all the tendons of the muscles here were removed? It means if we don't remove these ligaments and tendons of the muscles, it's impossible to demonstrate rete carpi dorsale. To demonstrate it, it's necessary to be located on the bones itself. So, rete carpi dorsale is formed by arteria interossa anterior. You can ask me, why anterior? We are on the dorsal surface. But can you see this small foramina? Where they are placed? On the membrana interossa antebrachia. So, anterior arteries penetrates this membrane, and we can find them here. Arteria interossa anterior. Sure, arteria interossa posterior also take place, but here we can see arteria interossa anterior. Ramus carpalis dorsalis from arteria radialis, ramus carpalis dorsalis from arteria radialis, they are ending part of arteria radialis. Then ramus carpius dorsalis from arteria ulnaris, from here, from arteria ulnaris. And together they serves for branching these vessels in intermetacarpal spaces from the dorsal surface. So here, between metacarpal bones, we can palpate the arterial pulse. If we try, we can palpate here arterial pulse. So these vessels, arteria metacarpalis dorsalis, are the branches of rete carpi dorsali. So they are branches of rete carpi dorsali. And again, the same demonstration on another scheme from another anatomical textbook, from textbook of Reichert, very famous Poland textbook, Polish textbook, and we can see inside of this yellow circle rete carpi dorsali, and that from it we can find arteria metacarpalis dorsalis. Here they are. And several another important details. Arteria radialis in anatomical snuff box. You know, in Europe in 18th century, there was a tradition to sniff tobacco, special sorts of tobacco, and those who were poor people and had no special, for example, gold or silver snuff box, they used this small place in our arm, which now named as anatomical snuff box. Here it is. So we can remember that it is between two tendons, tendo musculus extensoris pollicis brevis and musculus adductor pollicis longus, and tendo musculi extensoris pollicis longi. So we can find them, and inside of this place we can also palpate arterial pulse from arteria radialis. It's very important. And now for compare this information, let's try to watch the vessels on a special anatomical specimen. You can see that these two different specimens, and we can find here some peculiarity. Superficial palmar arch, arcus palmare superficialis, two right extremities with typical preparation number 82. It's typical. And atypical preparation number 84. Course of Ramos Palmaris Superficialis Arteria Radialis. So that was written that this is typical course of blood supply, and this is atypical. Why? We ask ourselves what is designated with sign. It's arteria ulnaris. Do you agree? It's arteria ulnaris. And what is designated by this question sign? It's arcus palmaris superficialis. Here, in the typical situation, it's formed by the end section of arteria ulnaris and anastomosis with Ramos palmaris superficialis arteria radialis. There. And what we can find here, it is formed by end section of arteria ulnaris and anastomosis with palmaris, Ramos palmaris superficialis arteria radialis. But this Ramos palmaris superficialis is quite large with thick diameter, and it passes not typically, not there, but from end part of forearm. So it's unusual situation. It's interesting that we can find such cut. It isn't anomaly, but variance, atypical course, but this variance we can find very often. And now, Ramos palmaris superficialis arteria radialis, it starts here, then it passes between muscles and will be located here. Atypical course of Ramos palmaris superficialis arteria radialis. It should be placed between these muscles of tenor, inside of the muscles, but it's superficially to it. Practically the same two specimens, but we can watch them from radial aspect. Ramos palmaris superficialis arteria radialis. Here it is the typical course, and here it is atypical course. And this is arteria radialis.